Hi, everyone, and welcome. Today, I have a very, very special guest. He was kind enough to come on and bless me with his presence, Dr. Tim Jackson. So let me give you the official bio read, and then we're just going to get in and talk, just like we're old friends. You will just absolutely love hearing from him. So just stay tuned. I promise you, this is going to be a good one. All right, Tim. So Dr. Tim Jackson is a doctor of physical therapy and orthopedic rehabilitation and a functional medicine provider. He holds a BS degree in health science and chemistry from Wake Forest University. He serves clients in over 15 countries through his telehealth practice at healyourbody.org. And we will definitely put that in the show notes for all of you to check out, and has helped thousands over the last 8 years. Dr. Jackson is the creator of the Heal Your Hormones Bootcamp for neurosurgeon Dr. Jack Krause's membership community, and has contributed to the book Diagnostic Testing and Functional Medicine by Amie Rosick. That's a good one too, by the way. He has been featured in the Huffington Post, the Bulletproof Executive, and Ben Greenfield Fitness podcast, which is one of my favorite, on multiple health and medical summits, and in 2 health documentaries. Damn, Tim's done a lot. Okay, he serves on the medical advisory board for greensmoothiegirl.com, a site with several million annual visitors, and for Your Second Half, a foundation that helps athletes with their career transitions. Dr. Jackson is available to comment on various functional medicine and wellness related topics such as digestive health, energy and fatigue, autoimmune disorders, and mold toxicity that we're talking about today. So welcome, Dr. Tim. Thank you for coming on. I appreciate it so much.
Wow, thanks for that introduction, Dr. Amie. I almost sound legitimate.
See, I told you guys you just love them. So I don't even know where to start. You know, we talk all things thyroid on this podcast. And like I was talking to you earlier, a friend of mine had to have her entire house renovated. So I really want to dive into mold toxicity today and thyroid. But let's first talk about you. Tell me your story. How did you even get into this whole functional world from the chiropractic world?
Yeah, so I started out or did my undergraduate degree at Wake Forest University, did all the pre-med requirements, did great. But during the winter break of my senior year, I had what I know now to be an unnecessary jaw surgery that put me under anesthesia for over 8 hours, almost 8.5 hours.
Okay.
And I ended up with 26 titanium screws and 6 titanium plates in my upper and lower jaw. And that, made me really sick, to say the least. And some underlying things that I had that were kind of subclinical. And because I was healthy and eating healthy and working out, they weren't an issue, or I didn't even know about them. But then, this major stress over surgery sort of allowed them to go from subclinical to clinical. And so instead of entering medical school that fall, an MD program, I decided to wait. And the more doctors I talked to, they said, you need to be an MD, and it's probably best if you don't become one, because you're not going to get any of the nutrition and exercise and functional medicine related stuff. Just get a ticket to play the game. So I got my doctorate in physical rehabilitation. And I started out treating athletes, weekend warriors, professional athletes, collegiate athletes, high school athletes. But I found a lot of them had imbalances that I couldn't fix with my hands. Mm-hmm. And so a lot of their external symptoms were manifesting from internal imbalances.
Mm-hmm. Yep, that's interesting. Yeah.
And so I've been doing functional medicine ever since, really.
So what did you find most of them had? Was it coming back to heavy metals, gut, mold? What did the majority, if you can answer that even?
Yeah, they probably had all of those things you just listed. But for example, frozen shoulder is tied to subclinical hypothyroidism.
Yep.
And so, that capsule, the joint capsule, gets kind of wound down and tightened down. And different chronic infections, for example, people with bilateral knee pain typically have mycoplasma antigen antibody complexes in their knee joint. And so you can do all the active release technique, laser, et cetera, but that's not going to help it. And so, I found there were a lot of people doing orthopedics not many people, at least at that time, doing functional medicine. And, you know, the feedback I got was that I was really good at it. So I decided to stick with it.
Nice. Well, I'm so happy that you said that about frozen shoulder, because that's one of I have a lab and symptom checklist. That's one of the symptoms I put on there. And it's a surprising one, because most people think, oh, you know, it's a sport injury or overuse, or they're just getting old or whatever. But you're right. It can be a symptom of subclinical hypothyroidism or undiagnosed hypothyroidism.
Exactly.
Yeah.
Exactly. And so, you know, I switched over into doing all functional medicine, and I haven't looked back.
Nice. Well, we thank you for being in the functional medicine space and not the conventional space. So thank you.
Thank you.
So before we dive into mold, I just want to keep on that whole joint thing. Yeah. And just bring this up and hope to God that we don't get, you know, taken down. So we'll use some like secret terminology that people will know what I'm talking about. I had a patient call today. She's actually going to trade her appointment for her dad because he's really, really suffering. He has no T3 and T4. I mean, just in the basement with both thyroid hormones. And after he got a certain shot that is out right now that is supposed to protect us from a certain said virus, he went from like a pain level of like a 2 or 3 in his joints to like an 8, and now he's on methotrexate and is in crazy severe pain. Have you been seeing this connection at all in your practice?
Yeah, I have, with those types of shots in general. You know, because the cytokine storm that's created, you know, the interleukin-6, interleukin-6, TNF alpha, interleukin-1 beta. Those are the primary inflammatory ones, and they, you know, create havoc throughout the body. And the thyroid, as you know, is very sensitive to oxidative stress. And so cytokine storm is just a form of oxidative stress, basically. And these shots, you know, they can create inflammation and symptoms in the brain, really any system in the body. Whichever system is the most weakened or the most facilitated, that's where the symptoms will arise.
It's interesting. Yeah, I wanted to ask your opinion on that. So before we got into today's topic. Okay, so mold. People are like chomping at the bit for this topic. Mold and the thyroid. Just start somewhere. I'm just going to hand it over to you. Go.
Yeah. So, I mean, mold is really much more prevalent than people think. A lot of people believe that they have to have a major hurricane or their roof is completely blown off in order to have mold exposure, or their house has to be 150 years old. But that's simply not true anymore. And the way they build houses today, you and I were discussing this before we went on air, you know, they throw up the framework and then they may not come back for a while. And so, you know, that leaves the framework and all the other parts of the home exposed to the elements. And the important thing for people to remember is that mold behaves differently indoors than it does outdoors. And so a lot of times I'll get people asking me, oh, well, Dr. Tim, I went to the Amazon and I was fine. And that's because you have, just like in the gut, you have checks and balances. So you have a system that keeps one species from growing and proliferating too much or to an excessive degree. And so basically with the mold, and when it gets indoors, when you have just 1 or 2 species and you're exposed to EMFs, you know, from Wi-Fi, 5G, etc., then that's going to cause mold to behave differently. And Dr. Dietrich Klinghardt has shown that mycotoxins or mold will produce 600 times more mycotoxins when exposed to non-native EMF fields.
Oh, I did not know that. That's interesting. Okay.
Yeah.
And we have EMF all through our house. I mean,
yeah, exactly. And so, you know, mold is an issue anyways, but in terms of relating it to the thyroid, one thing that predisposes you to being affected by mold is decreased body temperature. So even if it can be cellular hypothyroidism, right, where the T3 is not getting into the cell. And so that's going to make you more predisposed to mold toxicity, because a thyroid hormone, there's two ways to change the function of a protein: change the shape or change the temperature. And so you change the temperature when your body temperature goes down, and that's independent of your thyroid labs like free T3, reverse T3, thyroid antibodies being normal. And so conversely, though, you can have an optimized thyroid, and then you get exposed to mold and you start developing hypothyroid symptoms, because the inflammation that's created all throughout the body, mold and mycotoxins specifically block a pathway called NRF2. And that's how we produce our antioxidants. That's how we detoxify. And glutathione is very important for protecting the thyroid gland and the thyrocytes. And so when it's not getting produced, the thyroid cells get damaged more easily. And so go ahead.
Oh, wait, stop there for a second, just so we can clarify and help the listeners understand everything. So with thyroid, you have a lower body temperature because you're hypo, you're in that deep, like everything is slowed down in the body state. So that low body temperature is going to make you more sensitive to mold toxicity, or vice versa.
Well, so it can happen either way. You can start with an optimized thyroid, and then you get exposed to mold and it lowers the thyroid. You can, or it can happen the other way. And so, it's going to cause weight gain, decreased ability to detoxify. And I don't know if it's a direct or indirect connection with the low body temperature making you more predisposed to mold. But, obviously all your biochemical reactions are slowing down when your body temperature drops. So you're not getting rid of the mycotoxins, and they're bioaccumulating in the adipose tissue. And not only that, they cause your body to produce more fat cells. And so I'll tell people, a figure competitor, I know you have experience with that. I worked with years ago in North Carolina. She was extremely regimented, and she gained 15 pounds in 2.5 weeks. And her house was only 3 years old, but she had a leak in her roof, and her mycotoxin levels were through the roof, and her eyes were bloodshot. And after about 3 weeks, she was back to her normal weight.
Wow, that's crazy. Okay, that gives you some food for thought, because as a thyroid patient, you're already gaining weight, or you can't lose weight if you're not optimized. So then to have that on top of it, and you're building up mycotoxins in your fat, and then you're getting more fat buildup. And then, well, we know that estrogen is stored in the fat too. So now you're estrogen dominant because you have more fat. Just a vicious cycle. Vicious.
Yeah. And speaking of hormones, I've had guys where their total testosterone is 1,000, which, you think they're going to feel like Superman. But when you have inflammation, that aromatase enzyme is going to convert more testosterone to estrogen. So then you're going to become more estrogen dominant, which stresses the adrenal, hypothalamus, pituitary, adrenal, thyroid axis. So it's just a vicious cycle.
Crazy. And I always tout the importance of testosterone for men and women. And then half the time for the guys, they're not testing their estrogen level, because just like doctors forget that women have testosterone, doctors forget that men have estrogen. And so they don't get their estrogen levels tested. So like you said, they could have 1,000 and, oh yeah, you're good. But nobody's looking at their estrogen level, walking around at like 500. So
or sex hormone binding globulin, et cetera.
Exactly. But, sorry, we sidetracked there, but
but back to people being exposed. You don't have to have visible mold, or you usually won't be able to smell it. Now, there's many different types of mold. Obviously, black mold, very dangerous. You can see that and usually smell it. But for example, aspergillus, which affects the immune system and the respiratory tract mainly, that you can't see or smell. And, I've had patients who are millionaires, and they get offended when I suggest that they have mold, but it has nothing to do with how clean your house is. It's more about the structural integrity, the outdoor environment, the circulation of air. And that's another point I wanted to make is that, we've created energy efficient homes, but it's come at a cost, and that cost is indoor air quality.
Mm-hmm. Okay. Yeah, because you and I were talking before this about how they're manufacturing homes now, I guess just in PA, or maybe there's some other companies.
There might be some other, I'm sure there are other companies now. This was like 2 years ago when I looked into it. But yeah, they're creating them, in a very controlled environment. And then they're shipping them to the location and doing all the construction within 1 to 2 days. And not only that, even if you just go to Home Depot or Lowe's, there are certain brands of materials that are created to be less conducive to mold growth.
That's cool. So at least there's hope, right?
Yeah,
so even
exactly.
if you have, whether you have an old home or a new home, there's still hope.
Right. Yeah.
So how do you test your patients then?
So I do a urine mycotoxin test, but it needs to be provoked. So you can provoke it with an infrared sauna session, a biomet session, liposomal glutathione, a glutathione push, all of those, and then collect the urine sample 45 minutes later, 45 minutes to an hour later. Great Plains Laboratory has one. Vibrant America has one. And they test for anywhere between 11 to 30 different types of mycotoxins. Oh, wow. And so when you get them back, let's say your results say that aspergillus is high, stachybotrys is high. We can't say, 20% came from your current home, 10% came from your undergrad. We just know that that's your current body burden. And so we definitely want to follow up by testing the home to make sure to rule that out, because if we try to detoxify you and you're still being exposed, you're just going to be treading water. But like behind me, I don't think you can hear it, is the Air Doctor, which is an ultra HEPA plus carbon filter, and it filters volatile organic compounds, mycotoxins, viruses, bacteria. It filters down to a very, very small size. And so after you get the urine mycotoxin test back, let's say that your home, has a certain area that needs to be remediated, then you can have that done. And then you detoxify your body by using binders and supplements to support the pathways that have been blocked. And when someone has mold toxicity, it kind of blocks any other therapies from working. So, if you get someone, they just don't respond to any supplements, any medications, any IVs, any biohacking equipment, then there's a good chance that mold is an issue.
See, that's interesting. I just recorded a podcast that'll be released this week, just a mini one of thyroid hormone resistance. So whenever we have someone, and I've seen patients like this, that they can't even tolerate 2.5 micrograms of T3. They get the sweats, they're jittery, their heart's racing. And, we're looking at them going, that's enough for your pinky. What do you mean it's making you jittery? And usually that's a resistance to the thyroid hormone. And we have to look at all those underlying factors like, your gut and cortisol. But now hearing you, mold could be a big one.
Yeah, definitely. And, anything that creates inflammation in the body, as you know, is going to activate the stress response. And eventually, initially it'll cause high cortisol, but then it'll cause low cortisol. And you need cortisol to escort thyroid hormone into the cell. So I'm sure you've talked about that ad nauseum before, but, not all cortisol is bad.
Right. Well, I think I'm glad you brought that up, because I think that is the general belief system, especially in the thyroid community, that we want low cortisol. We want to, decrease that cortisol, decrease the cortisol. Cortisol makes you fat. It interferes with T4 to T3 conversion, but we forget that we need some. And that's why some thyroid patients are on hydrocortisone, or we have to use like a glandular supports for the adrenals because they're just flatlined.
Yeah. And I mean, just to put it in perspective, if we drained your body of all cortisol, you would die within 30 to 40 minutes. if we drained you of all estrogen and testosterone, you wouldn't feel well, but you're not going to die anytime soon. So, cortisol is a hormone. That's why adrenal insufficiency or Addison's and Cushing's are such huge issues. But you have those two ends of the spectrum, but then there's everyone else in the middle. And those are the people you and I work with.
Right. Right. When they're getting no answers from conventional medicine, they're like, please help me. Please
right.
Help
exactly.
Me. So I want to ask you a question before you move on, so I don't forget. So it's interesting that you said that you use liposomal glutathione as a provoking agent to test. So when someone takes, because I love liposomal glutathione. So when someone takes that and feels worse, could that be because they're actually kicking up the mycotoxin? They're like actually making them move in their body?
Yeah. So in general, with any form of glutathione, whether it's an IV push or liposomal or transdermal, people either start feeling good and stay that way, or they have a honeymoon period and then they crash, or they just feel terrible altogether and they never feel better. I mean, not never, but you know what I mean. And so that can typically mean that their phase 1 and phase 2 and even phase 3 detox pathways have been shut down. And, they're not able to detoxify the things that have been provoked by glutathione. And that one of those could be mycotoxins for sure.
Interesting. Because I know like you want to stay away from it if you have amalgam fillings, because that can push the mercury. So we could get into heavy metals, but we can go down all kinds of paths, all kinds of rabbit holes, Tim, all kinds of rabbit holes. But that's interesting, because I think a lot of people, and I know my patients in the past have tried it, because you hear it's a potent antioxidant, you hear it's great for the liver. I'll use a liver support along with glutathione if someone has elevated liver enzymes. So it's interesting that if they feel worse, that could be a factor.
Yeah, absolutely. Yeah. Definitely.
Yeah. So I want to ask you so when you see people, and I talk about this a lot, and we're going to kind of bounce back and forth between multiple topics.
Sure.
Because we have a lot of questions too coming in. So when you see thyroid patients, what is the biggest mistake you see people with thyroid issues making in regards to their care? Is it not getting tested? Is it not looking at all the factors? What are you seeing?
Well, what I see mostly is that people, even if their provider is aware of the appropriate thyroid markers, they might even test reverse T3, free T3, and the thyroid antibodies. If they don't test anything else and they think that, okay, thyroid's low because thyroid's low, and, just give you more and more thyroid, that's the problem I see. And, 60% of T4 is converted to T3 in the liver, 20% is converted in the gut. And so if the liver, gut, gallbladder axis is off, then that's going to dramatically affect your thyroid. And, another thing to point out is that when people have stealth pathogens, viruses, bacteria, mold, etc., that makes the blood hyperviscous. So it's extra thick. And nutrients and hormones and vitamins, minerals, etc., can't get into the cells like they should. And so you have to address the coagulopathy, if you want to use the fancy term. And that's where things like systemic enzymes come in. And Kent Holtar talks about this a lot. And, going by body temperature. And not just T3 levels, because everyone's afraid that they're going to give you a heart attack if you take too much T3. Yeah. But if you have too little cortisol and you're on a lot of T3, then that could happen, but it's unlikely. And so getting the cortisol level up and balancing the T3, sometimes addressing the mold, the thyroid will come back online. Because one thing mold does is it beats up the pituitary gland. I mean, it's like a jab, right hook to the pituitary.
Okay.
And so you got to do a little massaging, not literally, because you'd have to cut your brain open, but you know what I mean.
Yeah.
Yeah.
That's not good. Yeah. Well, no, it's funny that you use that analogy because so we can double this up. I always say antibodies are like little soldiers. And if you have Hashimoto's, you have those little soldiers that are going out and beating the hell out of your thyroid. So if you have little soldiers beating the hell out of your thyroid and you have mold beating the hell out of the pituitary, you're screwed. Like what are you going to do? You're not going to feel good at all.
Right. Exactly. And so I see that happening a lot. I see the other thing I see is that people will address their sex hormones prior to addressing thyroid. And, if glucose, insulin, cortisol, and thyroid aren't balanced first, it's like Maslow's hierarchy of needs. You have to address things in a certain order.
Mm-hmm.
And so I see that a lot, and then people won't receive the benefits that they think they're going to receive, from thyroid hormone, exogenous supplementation. But the other thing is just general detoxification. There's so many endocrine disrupting chemicals in our environment, and then they end up in our lymphatic system and in our adipose tissue. And so just getting some of those out, I mean, you need to get them out anyways. So getting them out may improve your thyroid function.
So how would you're so right. I mean, just the estrogenic compounds that we're exposed to on a daily basis is insane, which is why I always test estrogen levels in everyone. But how do you go about, like, so a person comes to you and obviously you test their thyroid. Now you're looking at hormones like the sex hormones, cortisol, adrenal, insulin resistance is a big one. And kind of what are your steps in seeing if they have a burden on their system, like chemicals or like mold? I mean, I know we talked about mold testing, but what else will you do in those next steps?
So a lot of times I start out with an organic acids test, especially the one from Great Plains, because it doesn't test for all types of mycotoxins, but there are 5, maybe 6 markers on there that can indicate the presence of mold. And, an organic acids test is going to give you a window into gut health, neurotransmitters, vitamin status, glutathione levels, oxalate levels, amino acids. And so I think that's a great place to start to get an idea. And then if people want to do, like, after we do some treatment, if they want to do a provoked urine mycotoxin test, we can certainly do that. But, it's important to know a lot of people want to just take probiotics and fix their gut. But your gut, all the way back in 2012, I wrote an article on how mold jacks up your gut. And if you want to get really scientific, it decreases a hormone called alpha MSH. And alpha MSH, people know it even if they don't know the name, because it makes you tan. So people love it, especially women. But they actually used to give it to women in a shot for PMS. But it was fixing too many things, too many other seemingly unrelated issues. And so they banned it.
Of course.
But that's, of course. So kind of like the peptides.
Right.
But, if you can get the mycotoxins down and get alpha MSH back up, because alpha MSH is a neuroregulatory peptide, and it's produced in the anterior pituitary, and it controls cytokine levels, inflammation, sleep, brain health, sex drive. That's why the peptide melanotan 2.
That's what I was going to ask you about.
Works on sex drive.
Yep. So would melanotan, I was going to ask you about the peptides. So would melanotan 2 be, I mean, it's kind of classified as an anti-aging peptide, right? Because it does exactly what you say. It works on so many different levels, helping so many different systems, right?
Yeah.
When
I took it, I got really, really tan, like abnormally tan.
Okay.
I kind of looked like I was on Jersey Shore or something. But so I had to back off on the dose. But it definitely helps. It's the closest thing we have to actual alpha MSH, at least that I'm aware of. And so in terms of the order of addressing things, mold, you got to get that out first. Then you can work on fixing the gut. and then bringing down the systemic pathogen load, because one thing that all mycotoxins have in common is that they're immunosuppressive. And so when you suppress the immune system, candida, viruses, mycoplasma, Lyme, they all just go through the roof.
Right. And that's where we'll see the chronic Lyme symptoms, the
Right.
joint pain, the aches, the leg pain, the inflammation left and right. Epstein-Barr virus will flare into an active state. Yeah, that makes sense.
Exactly.
I like how you're tying all this together. This is good.
Thanks. So, well, I mean, it's coming from me. I don't know how it cannot be good.
Well, you're right. I mean, come on. So, okay. GI map. What are your thoughts on gut testing? I've been using the GI map more on patients. I think it's kind of cool, and the amount of things that it tells us. So what are your thoughts on that? Do you ever throw that in the mix?
Yeah, the GI map, I do that. That's the stool test of choice for me at the moment. I've been using it for several years. And, you get an idea on there of, where you need to focus your energies. And I'll give you an example. My friend who owns a bunch of pain management clinics, his wife was going to a hormone clinic here locally. And that's all they do is sex hormones. Like, you come in and, if you want to test thyroid, well, that's a different program. I'm like, that doesn't make any sense. Right. But her beta glucuronidase was off the charts. So she couldn't detoxify anything, especially estrogen. Yep. And that was slowing down her thyroid. And so the GI map I love because you can also look at secretory IgA. Yeah. If secretory IgA is low, then you know that there's HPA or adrenal dysfunction, and there's a lot of stress in the body. And, I haven't heard a single person besides myself, maybe one other doctor, mention secretory IgA during this whole, fiasco that's going on, because that's what lines your mucous membranes and prevents any sort of microbe from getting in your body.
Mm-hmm. Mine was low. Mine was in the toilet. Yeah.
That's because of all those deadlifts.
It's all the you wanted to talk about deadlifts today. You had to sneak that in somewhere, somehow. So here we are.
Yeah.
We're on there. There we go. It could be from all the deadlifts. It could be from just running a business and not getting enough sleep.
Could be from having to deal with me.
And that too. We're going to put that in the mix. Exactly. Yeah. Okay. Do you want to talk about deadlifts? Like for real?
Yeah. So, from the orthopedist in me, people will call it the deadlift, but it really should be called the health lift, right? It's that hip hinging motion. And, if you're listening to this and you stretch your hamstrings, please stop, because your hamstrings being tight are a sign of posterior chain dysfunction. Posterior chain is just your glutes, so your ass, your hamstrings, and your lumbar erector muscles. And most people, because we sit so much, their glutes are turned off neurologically, and their hamstrings are trying to stabilize their pelvis somehow. But in order to get the glutes activated, you have to stretch the hip flexors, activate the glutes, and you can do that through things like hip thrust, single leg bridges, and then do your major lifts like deadlifts. But, people have heard of the rotator cuff, but the glutes are part of the hip cuff. So they serve the same purpose. They suck the head of the femur right up into the acetabulum. And so I tell people, just pick up heavy shit and put heavy shit down.
That's good. I like that. Keeps it simple. Keeps it really simple.
And when people say, "Oh, well, that you're going to hurt your back," I'm like, no, if you don't learn to do it, you're going to hurt your back.
So I always say that God let me power lift for 3 years. So I loved deadlift was my best because I have long arms. So, and I can do the sumo. So I set a record in deadlift, loved it. And then, well, I don't know if I never told you this. So I have scoliosis. I had surgery done. This is Erie, PA. We did not know about chiropractic back in 1985. So
I thought you were born in 1991.
Oh, that's right. All right. So in 2001, We didn't know about chiropractic in Erie. So I had the surgery done. Well, they put the rods in, they took the rods out, now I'm fused. So I was a powerhouse for powerlifting for 3 years. And then all of a sudden the deadlift would kill me. So I went from 309. Now I'm like 85, 95 pounds. It crushes my ego every time I do it. But if I go higher than that, it hurts. So what can I do to increase my deadlift?
So one thing you could do is single leg deadlifts. That is a way to get the same motion and work on balance, and it gets glute medius and glute max. You want to do it with whatever leg you're standing on, 20 degrees of knee flexion, because that's what maximally activates the glutes. So working on those, and then you said they took the rods out.
Yeah.
Okay,
and then they took a piece of my hip and fused.
But you said that they kill you in your upper back?
Lower back. Like
Lower
I get
back.
a sciatic pinch if I go
Okay. So what's happening is you're getting a closing down pattern of the facet joints and the lumbar spine. And so usually along with that, when I talked about people with tight hamstrings, so tight hamstrings, glutes turned off, then tight spinal erector muscles. And because the muscles of the spine are vertically oriented and muscles can only contract, when they contract and they're hypertonic, they're closing down the facet joints, which is where the nerve roots exit. And so doing some soft tissue release, self-myofascial release with a lacrosse ball.
Yep.
A tennis ball might be too aggressive in the beginning. Laying supine with your feet flat, rolling side to side. Don't go across the spine, just try to go up and down. So that will release, and then you can do some corrective exercise to activate the glutes and then go to try the deadlift.
Okay, so actually do that in one session. I like the rumble roller too. So like do something like that, loosen it, corrective exercises, then deadlift.
Right. Yeah.
Okay.
Exactly.
I like this. It's kind of like a Ben Greenfield episode. We're just talking about everything. So it'll be like
pretty much
mold, thyroid, hormones, deadlifting, and your spine.
Yeah, exactly. Pretty much everything except your teeth, but we can talk about that.
Nah, we'll save that for another time. We'll bring it back on. Yeah. So I have a ton of questions coming in that I want to read off to you, have you answer. We'll just leave these in the podcast because I think the questions are great and it's going to be great to hear your take on a lot of them. So let's see. A lot of people are saying interesting about frozen shoulder. And we moved into a house that wasn't supposed to have mold. It's awful. And I can't get my thyroid regulated. So what would you say to a person? I mean, what are you going to do if you just moved? You can't move again, right? Is there a proper eradication process?
So there is. It can get expensive and you have to kind of do your homework on companies. So you want a company that can use a camera to look behind your walls for areas of increased condensation, because it's very easy and it depends on the state. A lot of states, the company who tests your house, they're not allowed to do the remediation. But in many states, it's legal for that to happen. So they'll just come in and they'll be like, "Oh yeah, Amie, we need to tear down your whole house," because they're going to charge you $80,000. But if you can isolate it and say, "Okay, this area is good, this area is good. Oh, that area over there, we need to inspect that further," and so then you can get the mold from behind the walls. You need to get your HVAC system and ductwork cleaned at least once, preferably twice per year. And then running a high-end air filter, which I recommend the Air Doctor because it's one of the least expensive and most efficient, has the best feedback. And I know doctors who only treat mold and they recommend it. And so the other thing is, even once you have mold remediated, you want to make sure the proper structural changes have been made. So if your land that you live on, if it's sloped at a certain degree that allows water to accumulate, or snow in your case, to accumulate on underneath your house, and there's not a lot of sun for evaporation, then you want to fix that issue. And you want to always make sure that your indoor humidity never exceeds 50%.
Oh, see, that's interesting because us ladies like extra humidity for our skin. You asked how I stay looking 25.
Yeah, exactly. So maybe we should just get mold in all of our houses. That's what I'll go grow some mold after this. And if I die, it's your fault.
Okay. So below, would you say humidity below what? 50?
50%.
Okay. Yeah. So I can still keep it at like 35, 40 to get some moisture. And that's a good.
Yeah. You can still glisten at 35 to 40%.
Okay. I'm down with that. I can do that. Okay. Does mold protect itself with biofilm?
Yeah, in many cases it does. So when you so I mentioned binders and detoxifying the mold. A lot of times it's helpful to take a systemic antifungal. It doesn't have to be a prescription. It can be a nutraceutical. But if it is prescription, yeah, you can certainly use biofilm busters with it. Now, when you break open biofilm, so independent of any antimicrobials, you're going to kill a bunch of stuff because your immune cells can get to it now. Whereas before, it's kind of like if you have 4 bodyguards in front of you and I try to right hook you, they're going to block it. But if they're gone, boom, I'm going to take your head off, right? So that's the biofilm analogy. But yeah, addressing biofilm. But the key to remember is that the good bacteria in your gut also live under biofilm.
Right. That's why I like the GI map, because it breaks down the good and bad bacteria, what you're high in, what you're low in.
Mm-hmm.
Yeah,
exactly. Yep. That's a great question.
Very cool. Well, thanks for answering that. So this one, I think I know the answer to, but I'm still going to let you answer it. Are T3 meds bad for mold patients?
No. I think if you're dealing with mold and you've been exposed to a lot of it and you're very sensitive, and I want to take just a second to differentiate. So there's mold toxicity and there's mold allergies. You can have both, but usually people have one or the other. And so what we've been talking about is mold toxicity. Now, a mold allergy is an IgE anaphylactic type allergic reaction to mold. Mm-hmm. And so, you always want to kind of keep those two separated. But as long as you're addressing the mold, if you need to be on T3 in the short term to function, because we still have to keep living our lives, then I think that's fine. Assuming again that cortisol levels are regulated, and the thing you want to check is common for mold to lead to very elevated TPO antibodies and antithyroglobulin antibodies. Mm-hmm. So if those are high and you take T3, it's not really going to address the problem. That's more something for low dose naltrexone type stuff.
Oh yeah, I like LDN. It's good stuff. Yeah. So if someone has high antibodies, they're taking, let's say we have them on Armor, T4, T3 synthetic combo, and they're still not getting better, and they test positive for either mold toxicity or mold allergy, use LDN to bring down the inflammation, bring down the antibodies, and that will actually improve the thyroid function, and how the body is using the thyroid hormone replacement therapy that we're giving it, right?
Yeah, so the LEN and similar substances modulate TH1, TH2, TH17. And so it'll help calm down the antibody attack on your thyroid, but you still want to get the mycotoxins out because, they can cause harm literally in every system of the body. And one just interesting fact, to put it in perspective, if you look at CT scans of patients with MS and patients with mold toxicity, and I block out the name, you can't tell the difference. Can't tell the difference.
Oh, that's huge. That's a big one. All right. Thanks for sharing that one. Yeah. Because if anyone knows MS.
Here, let me drop the mic.
Yeah. Mic drop. I mean, lesions upon lesions on the brain and spinal cord of MS patients. So you actually see that in mold toxicity.
Mm-hmm. Yeah. And it's been, Dr. Shoemaker started talking about that back in 2009. And that's why I have a colleague in Virginia. She's a DO, and she's trained in the Bredesen Alzheimer's protocol and in mold toxicity. And someone referred her a patient who had been diagnosed with Alzheimer's. And she said something just didn't feel right. So she worked her up for mold. Turns out it was mold toxicity. Patient no longer has the diagnosis of Alzheimer's.
Oh my gosh. Okay, that's going to lead to a question of mine. If two people are in a house with mold, will one respond and one won't, or will they both respond to some degree?
So I tend to work with families. I usually start out with one member and then they just kind of toss me around, so to speak. But people can react differently. So let's say there's a husband and wife and two kids. The wife may be very reactive, the husband moderately reactive, and the kids may not be affected at all. But part of that has to do with something called the HLA, human leukocyte antigen genotype. I don't test for that anymore. I have it. Dave Asprey has it. It's called the dreaded genotype. 25% of the population has it. You can still detox mold in those people. And what I found is that it was just stressing people out because, it's that neuro-linguistic programming.
Yeah.
And it was affecting their physiology from a stress perspective. So I just got rid of it.
Okay. Interesting. So that's easily going to lead into this next question of, let's say you don't see mold in your house, you can't find it, but testing is saying that you have mycotoxins. So what is the treatment? I mean, do you do treatment on the body that can help, or do you bring somebody in to test your house? I would think you got to test it even if you can't see it, right?
Yeah. So you can't go by sight or smells. I'll give you my parents as an example. They're very type A about the cleanliness of your house. I mean, if I put down a glass of water and I go to the bathroom, when I come back, it'll be gone because they think that's just like a crime against humanity to have something
Right.
on the counter. And so they argued with me for months. They didn't have mold. They don't have mold, blah, blah, blah. So I said, well, here, you test it. And if it comes back negative, I'll pay for the test. And it came back very high, which would explain the 19,000 types of allergy medication my dad has. So, yeah, and you couldn't smell it or see it in their house. I mean, and my mom keeps the house immaculate. Now they have an air doctor, they have the house remediated. You can't be a prophet in your own kingdom. So I have to kind of send them to someone else and I'll just tell them, okay, here's what I need you to tell them.
So true. It's just so true. You can't, especially parents. They don't want to listen.
Exactly. They still see you as that little kid, pre-pubertal.
Exactly. It's so true. All right. So we have one last question. Then we have a lot of questions on how to contact you, which we will put all of that information in the show notes, but I'll let you close it up too. So one last question before I hand the mic over. While we are waiting to afford all of this, and I'm assuming that means just, the remediation, the testing, all that, we are running lots of filters. Should we start the health tests such as OAT while we are in it, I guess, in the house with the mold, or wait until it is cleaned up? Okay, that's it. I see what she's saying. So do we test now? We're still waiting to do the remediation in the house to fix everything, or do you just wait until the house is done, give it some time, then test your body?
So what I would do is I wouldn't do the oats test right now, but I would go ahead and start attempting to detox my body. It's not going to be totally successful, but I would use binders in combination with an air doctor. Then after you've done that for a couple of months, you can do an oats test, but you don't have to have the house completely remediated in order to do that.
Okay. Nice answer.
If that makes sense.
Total sense. So what kind of binders do you like? I like the simple ones. I don't like getting into like the TCD and, like the really like intense, big, multi ingredient. You're taking 50,000 ingredients in one packet kind of protocols. What do you tend to like?
I like the micro formulas or Cellcore Sciences bioactive carbon biotox. And it binds histamine, aldehydes, mycotoxins, and a few other things. But you have to be careful with just using things like activated charcoal because it'll bind the mycotoxins, but not tightly, and then they get re-released. And that can create, sort of like a relapse type thing.
I've heard of Cellcore. I have to look into them more. A patient told me about them, and she said she responded tremendously.
So Cellcore is the provider brand, but if patients are buying it on their own, micro formulas would be it's the same thing. They usually have slightly different names of the products.
Okay. Do you have a link? Do you have like an affiliate link we can put in?
I don't have an affiliate link. I can get one.
Well, yeah. Why don't you get one? We'll put it in the podcast show notes.
All right.
There you go. And get
There
one
you
from
go.
the ear doctor too.
There we go.
There you go. So what are your final thoughts, final words to the listeners, and then tell them how they can find you? Because we got some people on here that they want to hook up.
Yeah. So final thoughts, I would say it's usually or almost always very difficult to heal in the same environment in which you became unwell. And so your environment is huge, from EMF exposure to light, artificial blue light versus blue light from the sun. Your environment determines a lot, not just the people you're around, but the type of mattress you sleep on, the type of chemicals, whether you have carpet, hardwood floors, whether there was water damage. So your environment determines a lot of how well supplements will or won't work.
Mm-hmm. Very well said. Especially, your entire environment, the people, like the mattress, the air, all that.
Yeah. Okay. And so people can find me at healyourbody.org or .org. They can message me through that site. And if they put in the subject line, Dr. Amie 10, I'm offering your listeners 10% off on an initial consult with me.
Woo! Well, thank you for that. That's very kind of you.
Definitely.
Yeah. And we will definitely have you back on because there's a crap ton that we didn't even get to cover. So
yeah, and we got to get the Ravens flag like right back there.
No.
Baltimore Ravens.
Black and yellow, black and yellow, black and
purple and black, purple and black.
Go Steelers.
Go Ravens.
Woo! All right, Tim, thank you so much for coming on. And for everybody that's like, no, don't go yet. We will have you back on, I promise, and very, very soon, because this was one of the funnest guests that I have had. Short of Elle Russ. She's pretty damn funny, but we love you too. So we appreciate your time.
Well, yeah, I just had to break the ice today. Next time you'll get to peel away another layer.
The gloves are off next time. Just look out. Forget about it.
Exactly.
Yeah.
Exactly. That right hook is coming.
Yeah, exactly. I'm looking forward to it. All right, Tim. Thank you so much for coming on.
Thanks, Amie.
All right. Take care. Bye.
See ya.